Good afternoon, everyone. I see we have counted down and we are now live. So again, thank y'all all for being here this afternoon. And we will start the meeting at 1:10. And we will first ask, first item of business, would ask Ms. Leanne Franklin, who's our Director of Spiritual Services here, for come up and lead us with a prayer. And then immediately following, would you please join me in the Pledge of Allegiance? Leanne.
Good afternoon. We gather today with much on our hearts and our minds. We pray for all of those affected by the hurricane in Florida and beyond. And we're mindful of those who are weathering storms in our own lives, our patients, our families, ourselves, whether these are storms of illness or trauma or crisis. We hold all these folks, all of us, on our hearts and in our prayers. We meet to serve our community, to use our resources wisely and well, to represent all members of our community fairly, to make decisions that promote the common good. We recognize our responsibility to the past and the future, and the rights and needs of both our patients and families in our hospital and clinics, and also all those in the community. As trusted servants, we seek blessings on all that we do, all that we think, all that we enact, on all of our efforts here today. May we act faithfully, wisely, and well. In your holy name we pray. Amen.
Amen. Leanne, thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We will now move to item number 3. I have been advised there are no citizens wishing to address the board today, so we'll move to item number 4. It gets a little lengthy here. I'm going to have to do some reading to make sure, with counsel sitting next to me, that I get this right. But obviously, we do have a public hearing. I will start by item number 4 on the consider approval of the resolution. Item number 4A. As chairman of the Board of Managers, I opened this public hearing today at 1:14, as required by Chapter 298B of the Texas Health and Safety Code, to consider only the following 3 issues: the amounts of any mandatory payments that the Board of Managers intends to require a provider participant to make, and how the revenue derived from those mandatory payments is to be spent, and 3, sets the amount of mandatory payments for the fiscal year ending in 2019 at a percentage of net patient revenue of an institutionalized health care provider located in Tarrant County Hospital District's geographic jurisdictional area. So that's kind of lengthy. We will then go to the citizens. Is there anyone, if anybody is here to speak, their comments will be in accordance with the Board of Managers' standard operating procedures. I don't think there's anyone here to speak, Corey, so I won't read the rest of the name. There has been no one else here to speak reference to this. Is there anything else additional, Corey, you need me to do? Then based upon that being read into the minutes, I will close this public hearing at 1:15. All righty, we will then move to the next item. The next item is on the agenda is I will now move that we go to item 4B. We will consider proposed resolution regarding settling the mandatory provider participation agreements and how revenue derived from those agreements is to be spent on the Tarrant County Local Provider Participation Program. Each of you have been provided a copy of a resolution, which we passed out here previously, prepared by the General Counsel with recommendation of the President and CEO for your consideration, which will be approving on the posted agenda items 4B1, 2, and 3. If there is any discussion regarding the amended resolution, I will certainly entertain those at this time. If not, I would entertain a motion to approve the resolution.
I'll make the motion to approve.
Do you need to read that?
Yeah. He has a copy of the motion.
It's right there. You got it, Steve?
Want me to read this? Robert Early, President and CEO of the Tarrant County Hospital District, and on the advice of Neil Adams, General Counsel, the Tarrant County Hospital District approved the resolution that, number one, authorizes the collection of a mandatory payment from each institutional healthcare provider located in the district. Number two, authorizes the use of funds collected through mandatory payments for the purposes specified in Chapter 29(8)B, Texas Health and Safety Code. And number three, sets the amount of the mandatory payments for the fiscal year ending in 2019 at 3.91% of the net patient revenue of an institutional healthcare provider located in the Tarrant County Hospital District's geographical jurisdictional area as set forth on Exhibit A.
I have a motion. I have a second by Mr. Montgomery. All those in favor say aye.
Aye.
Opposed, no. Thank you very much.
What you all did, that was the LPPF that was created last year. That is the mechanism for our colleagues in the industry, both the not-for-profit and the private sector, that we provide the IGT for. That brings additional money back in to the community, particularly for our colleagues that we try to help. And we want to make sure that we are a good partner to them and we're providing the services and help that we can do. So you've basically just allowed for what took place. Also, it was coincidental that I turned Dr. Weber's mic on when he said Robert Early. It was not by design. It just happened to be that part of the motion. So just to give you an idea, that's what we discussed and debated last year and spent time doing that. So I wanted y'all to know. And thank you, Mr. Chairman, and thank you, Mr. Chairman, for your first and seconds on the motion.
Thank you. In order to finalize the rest of the legal, as Robert indicated, we will now go to item 4C, which basically I will now move to item number 4 regarding authorization of the President and CEO to make intergovernmental transfers, the IGTs that Robert just made reference to, from the Local Provider Participation Fund. Again, I will need a motion. That motion, basically, I would entertain a motion. It's going to be in accordance with the wording that is actually found on 4C on the agenda, but I would certainly entertain a motion at this time.
Mr. Chairman, I move that we authorize the President and CEO of the Tarrant County Hospital District to make the intergovernmental transfer from the Local Provider Participation Fund of the Texas Health and Human Services Commission based on the Executive Commissioner, the Texas Health and Human Services Commission schedule or of requested IGTs for compensated care payments.
I have a motion. Do I have a second? I have a second by Mr. D.T. Wynn. All those in favor say aye.
Aye.
Opposed, no. Thank you very much. That will conclude that part of our agenda, so that will take us down now to item number 5, which kind of gets us back up on our normal monthly board agenda, which is the approval of the minutes. They had been provided to you previously. They're also been on the portal. If there's any recommendations or any changes, we will certainly entertain those now. If not, I entertain a motion for approval. I have a motion by Reverend Emerson, a second by Mr. DeBose. All those in favor say aye. Aye. Thank you very much. Board Chair report and action. Well, there's been a lot of action. I'm not going to take Robert. I know he's going to want to talk about something because I sat before this board last month and was very pleased and proud to say that Robert was recognized, as we know, being inducted into the Hall of Fame and from the Studer Group, and it was great. We're also going to talk about an award today, hopefully, that I'm going to let Robert talk about. It's just an outstanding, again, of where this institution is and the employees, and Robert always talks about the employees and the team, and I think that's why I want him to talk about this one. But I had the pleasure of being there, and it was a very exciting evening for John Petersmith, JPS. I will also want to thank the board. There's 27 days between now and November the 6th election. I know many of you have attended the town hall meetings. I thank the commissioners. I thank their staff. I know we've had, I guess there were 6, because we had one in Mansfield and one in North Arlington. Mm-hmm. So again, many of you participated, some of you in all of them, and some of you when you could. And so on behalf of myself, I appreciate that, and please to the commissioner staff, please express to them, and also with CGK Manus, and we'll tell him, because he certainly, and Robert, you and the staff were participating in all of them. So thank you all for that. And again, it's 27 days away. I'm also excited. It's been coming a long time. It's unfortunate, Trent. I talked to him earlier. I think he's actually out of town. We know today is the JPS, the Northeast Tarrant Medical Home opening at 4:30 this afternoon. What a tremendous thing. This has been coming, as you very well know, Roger, for many, many years. And I know Commissioner Fickus has been waiting on this, but most important thing, the wait's over, and we're going to have a tremendous facility to address the needs in that particular part of the county. So that'll be this afternoon at 4:30. We'll be attending. If any of you are available, we'd love to have you participate. And other than that, Robert, I think that's what I'm going to pass on to you and let you kind of cover a couple of our other issues.
A couple things I want to do. We all know how great Trudy Sanders is for this organization and how much Trudy does for us. Trudy has two ICU nurses with her today that are trailing around with Trudy to learn the ropes of JPS, which they already know because they're about the best ICU nurses you can find. But I want Paige and Sarah to stand up real quick. They will not like to be introduced in that manner, but they are wonderful young ladies, and I'm grateful to them. Sarah, do me a favor and remind me how many family members of your family work at JPS? Only three. We had four, but we have three. So should your family change in any way, it will make a significant impact to the workforce at JPS. So thank you all very much. The reason why I wanted to highlight these wonderful nurses that we have is that's part of we often talk about succession planning here and where do we go and what's the future. There's your future right there. And that future that they would gain through being with Trudy today and learning and understanding is what we talk about in succession planning. Succession planning is not on a piece of paper. Succession planning is through Wanda and through Trudy, and it's through Melinda, and it's through David. It's through people that take those younger folks in our organization and bring them up. And so not only are they skilled ICU nurses, but they'll be skilled leadership in this organization in the coming years. So make note of both of them because I think you'll see them at JPS for a long time, and that's beneficial to our patients and this community. The other person I want to introduce to you, who is a great asset to us, is our new Vice President of Quality. Tricia Swift, if you'll please stand. Tricia comes to us. Tricia is a wonderful person. She's got 16 years of experience in healthcare, but Dorothy, she's one of those smart ones. She got her doctorate in nursing. She's an Iowa girl. So she got her education up in Iowa. She started her first facility at the Mercy Medical there in Cedar Rapids, if I'm not mistaken. Started her nursing career there. Started as a bedside nurse, then went into quality, and she is an asset to us. So you'll see a lot of her. Dr. Weber has already gotten to know her. Tim Kramer, our CMO, brought her on board, and his wise decision is our gain. So in both regards, I think Tricia will be a huge asset to us. So Tricia, thank you for joining this team. Couple other announcements that I wanted to make. We have an opportunity here that there are two awards that I want to point out to y'all because these awards mean a lot to me because these awards were given to the embodiment of JPS. It includes you as board members and it includes the 6,500 people that make this place tick every day. And the first award is an international award that we received from the ATD Best Award. ATD Best Award is an award given internationally to companies who represent advancements not only in technology and relating technology expertise to their employees from engagement and retention, but also what leadership, and when I define leadership, I'm talking about you as board members set as an example for this organization to run by. The pillars, our destination metrics, how those destination metrics are carried out by the employees from the top to the bottom, from the bottom to the top of the workforce. And what's interesting about this is there are 45 organizations that are recognized internationally, and there are only 5 other winners that are healthcare related. 6 are from the insurance industry, 4 are from the consulting industry, 7 are from the finance industry, and there are probably some names in that group of 45 that you would recognize, such as Verizon and IBM and Samsung and Gilbane Construction, the types like that. Of the 45 that were recognized internationally, and the international winner is a company out of India, but there are companies from the former Soviet Union, there are companies from China, there are a good many from the United States. But of those 45, we were ranked 17th. And they do that by doing a survey of our employees about their engagement and their retention. That's a really great award, and it's owed to the great human resources team that we have, and what Pia and the assembly that she has beside her, helping her make things happen. That's a great asset. So that's a huge compliment to our HR team. It's also a huge compliment to all of us that get to walk through the doors at JPS, and I'm really proud of that award. The second award that we received is one that the chairman mentioned in his remarks, and that was an interesting evening. We went over to Dallas, where they happened to be holding their national convention this year, and it was modern healthcare. And modern healthcare, as you know, is sort of the journal and the Bible by which many in healthcare read and follow. Modern healthcare does a survey each year of your employees and what work conditions are like, what it's like to work there, what your benefits are, how you enjoy where you work, and it is related to the healthcare field. They choose 100 of the top places to work in the nation. And of that, at their annual convention, they recognize 75. We won this award for the first time last year. And out of the 100, we were ranked 55th. And that's a neat ranking. Out of 100 hospitals that are the best hospitals to work at, we were ranked 55. So what they do is they start at 75 and they recognize you, and your team goes up, or you go up and they thank you and they say a few accolades about your company and about your healthcare network. So when they got to 55, we were excited because we knew we had not backtracked. We didn't want to be 55 one year and 75th the next year, so we were excited. So when they got to Health Network 54, we were really excited because we thought we're one better than we were last year. And each healthcare network that they introduced, we clapped louder for because it wasn't us. So we knew we kept coming down the list. Well, they got all the way to 19th. So you all, as a board, have commandeered an incredible group of people that have got us from the 55th best recognized hospital to work in the nation all the way to the 19th. And I think you as board members need to take the accolades that are deserving of you. And I think that great team, some of which sit out there, is what makes that happen. And I couldn't be prouder of the team and couldn't be prouder to be the 19th ranked hospital for best places to work. So team and board, thank you all very, very much.
Thank you all.
And then the other thing I would mention as a follow-up to what the chairman mentioned is tonight the work that so many people put into the Northeast Medical Home. For those of you who did not see it on previous tours, if you can make it tonight at 4:30, it would be nice, because that may well be the prototype by which we look at clinics in the future. You will note when you go in that there's an open air to it. There is a good feel about it. It doesn't have a feel of an institutional type clinic. It has the feel of a place that is welcoming. They tell me that the colors are pastel in nature. I'm not sure what that is, but there is a nice sort of color scheme that makes people feel good. We have a section in pediatrics in the back, and I think they're going to get that to a point where the kids can play, and there'll be things back there. So we're trying to be much more conducive to our patient base. And the reason I'd like for you to look at is not only is this a celebration of the Northeast and the delivery that we can bring to the people in that part of the county, but also for you all to see the prototype, which we may well have one day in the Viola Pitts area, and we may have another in the Saginaw area and Everman and throughout our communities. This is a good package to take a look at. So I'm proud of what Angie and her construction team have done. We did a lot of the work in-house, and not all of it was hired out. Some of it obviously was, and we had a great construction crew that we used. But Angie did a really good job, and her team did a great job. So you can go out there and take a look at that tonight. So, Mr. Chairman, I have nothing more to announce other than those, and I'm happy to have had those announcements.
Well, Robert, I just want to say one thing, as I've said this many times, I'm humble and appreciate as chair, I get to go and be involved, and we started this meeting off day, I'm not picking on the attorneys, but reading a bunch of legal stuff for resolutions, so I'm going to digress one moment here, and, Robert is really, as usual, he's not taking a lot of credit, he's giving it to the team, and we as a board, to be number 19 is amazing. I was there that evening, and we're up against some of the biggest healthcare networks in this country, and so it was a personal pride thing as a member of this board, but also as chairman. I know each one of you would have felt the same way. I will end it this way by saying, when Robert said we were 55th last year, we're excited to be 54th. I think there's a show on TV, I don't watch a lot of TV, but I think it's Deal or No Deal, and you open a case and you hope you don't get the number that's the 0. It seemed like past 54, the excitement at the table and the enthusiasm and a little bit of the comments kept getting a little bit more hyper, and I think JR and some of the people may be in this room, but it was an exciting evening. But when we hit that 20 it was amazing. And the point I'm trying to make is this board, and with Robert and with this team in front of us here and the rest of the 6,500 employees that we don't get to see when we come here for these meetings, I think this board is very appreciative, Robert. And again, hope the employees of this institution know as a board we appreciate everything they do. That's quite an honor. But it was amazing, and the point I want to make is Robert and the team, we're not sitting there saying, oh, well, we didn't get 54th, maybe we'll get 53rd. Maybe we'll get 38th. It was exciting for me to watch highly professional people, not acting all that but highly professional people that have been recognized nationally for their work and their leadership. To see the excitement they had for this institution to be recognized. It wasn't about, oh, look at us, we're the best. It was like, this is just one more thing that takes JPS from what we think there may have been people thought about JPS years ago to what I call the JPS now. Yes, there's a lot of work still to be done, but again, Robert, to you and the staff, and I think I'm speaking for the whole board, congratulations. It's quite an honor. They don't just throw those things out there, so thank y'all very much. I want to back up. I'm sorry, go ahead, Ralph. Did you have a comment? Okay. You want to do it now, or you want to?
I just wanted to make a comment on the bond program.
Oh, sure. Go right ahead.
I know many of us have had a chance.
Turn that. Thanks,
Had a
Ralph.
chance to attend the public hearings, public meetings. I just think GK Manias deserves a compliment for the outstanding job he's done in presenting the program. Dorothy and I had a chance to attend the one in Commissioner Brooks's district, and this lady who spoke, no one could have done a better job in selling the bond program than her, to give her personal experience. And so, I've enjoyed them as I've attended, and it's a blessed thing that every place I've been, everybody's excited. Yeah, they're all for it, so I just wanted to comment.
Great comments, Ralph. Yeah, Robert spoke to Downtown Rotary, 3 weeks ago?
Yes, sir.
And I had the pleasure of introducing Robert, and GK was there. And both from that podium, like you just said, Ralph, it's not just during this town halls. He's been a true leader as he's come out and reported this board and dealt with the commissioners. So as I say, anytime we see him, we need to tell him, you're exactly right. I guess the largest crowd that I attended was, I guess we did one in North Arlington, but we did the one down in Mansfield. It was at Bethlehem at Pastor, I think Mike Evans' church it was where they'd been, and I think, Ralph, you were there. And it was a very large crowd, and the comments, there were several comments there also. But again, thank you everybody for your participation, and certainly, Ralph, I agree with you. We need to tell, every time we see GK, we need to tell him thank you. So I'm going to digress back to item number 6A. It says appoint members of a nominating committee. It's that time of year. And the chair of the committee, that's required by our bylaws, to make recommendations to the board of managers at the November 8th Board of Managers meeting. As chair, falls at my prerogative I'd like to appoint Roger Fisher, if he would serve on that committee. And I know, Dr. Simmons, you're relatively new to the board. We'd like for you to participate in that if you would. And Mr. Montgomery, if you would chair that, y'all can get together and all that and make your recommendations back to the board on the 8th. So I have the minutes so reflect that. Yes, it's 3 cookies. There's 3 of you, so you get 3 cookies.
You actually just ate your budget for lunch, but thank you for suggesting it.
Yes. Do you need a second on that? All right, item number 8, we will move along again. Robert, thank you for your report. Item number 8, we will ask Dr. Schrader, Chad, update from the Medical Executive Committee.
Yeah, what I'd like to do is basically leave the rest of my time really for consideration of approval for a change of the Department of Surgery. As we've discussed previously in this committee, there was a recent vacancy in the Department of Surgery chairmanship. There are procedures set forth in our medical staff bylaws as to how to fill that vacancy. And what we have as a Medical Executive Committee would like to recommend to the Board of Managers consideration of approval for Dr. Rajesh Gandhi as the chair of the Department of Surgery.
Is there any discussion? If not, I would entertain a motion.
I move.
Have a motion, Dr. Hire, have a second by Dr. Weber. All those in favor say aye. Opposed, no. Thank you very much. Chip?
So second order of business is also the allowance of a vice chair. So we'd like the Board of Managers to consider approval for the appointment of Dr. Daniel Ziegler as the vice chair of the Department of Surgery.
Any discussion for Dr. Schrader? If not, I'd entertain a motion.
I move.
Have a motion by Dr. Hire, have a second by Dr. Simmons. All those in favor say aye. Opposed, no. Thank you very much.
Thank you, sir.
Chet, anything else?
No, sir.
Great, thank you very much, and we'll pass on
and Chet-
congratulations. Go ahead,
Mr.
Robert.
Chair, Chet, may help for the board to understand that is a requirement from the MEC bylaws, and we're going about those procedures. But to Chet's credit and to Claims credit and others, they will go through a search, and we will begin that process for the finality of that situation. But you need a chair to make that work properly, and it will work properly. But I didn't want the board to be confused when we come back and you hear that there is a search for that chair, and you say, well, I thought we already put the chair in.
Point.
You have a chair in order because you need a chair, and that is a time period by which that needs to be there. Now there will be a conducted search. Is that fair?
Correct. So our medical staff bylaws allow for 60 days to fill a vacancy. And so the department is then allowed to determine the mechanism to which they decide that, and then have to propose somebody within that 60-day time period. So we'll have now, with the claims help, a search for a chairmanship, and at which point we may readdress the board for a change in the department chairman.
Rex, did you have a question?
No, I think he was talking.
Okay, great. All right, anything else for Chet? If not, we'll move to item number 9, which will be the update from the acclaimed physician group. Dr. Hochberg, Michael? There you are back there. I know last month you said it's your first one, so obviously this is your second one. Welcome. All right. Welcome, Mike.
So thank you. To just piggyback really briefly on what Dr. Schrader said and Mr. Early with regards to the search. So Acclaim has retained Whit Kiefer to help manage the recruitment for the Acclaim Surgery Service Line Chief. Whit Kiefer is one of the preeminent national healthcare recruiters amongst other types of services that they provide in recruitment. We have retained them. We are in the process of forming a 21-member search committee for this, which will be multidisciplinary and interprofessional, which will include members from Acclaim, from our various departmental chairs, from our nursing team, and inclusive of a number of other individuals. With the goal, as we go through this search and we narrow down candidates, that there will be strong and full alignment between the eventual named person on the Acclaim side, as well as once the vote comes down again, if it should, between the Department of Surgery as well as Acclaim.
And your
So-
21-person search committee is the smaller version, correct?
Right, there was 50 initially, and I
Yeah.
just had to narrow it down.
Michael came and said, we want 50 on here, and so we thought, well, maybe we could cut it down. So-
I just thought it was really critical that as many people as possible could weigh in on this. So then I could ultimately say, this is the person we want. So, that is in the initial formation. We are formalizing the leadership profile for that. And then, so you should, begin to see that disseminated online on Whit Kiefer's website and as they go out and begin to recruit. So it's a really exciting time for us, and we're hoping to gain a number of potential interested candidates, which of course includes potentially some internal folks as well. Since we're talking a little bit about recruitment, we have made a couple of slight changes in reorganization within Acclaim, on the back office side of things. And so we have created 2 new positions, cobbled it together amongst a number of other positions. One is a more robust version of our manager of physician services that is now a director of physician recruitment and physician transactions, with a much heavier focus on the regulatory and compliance side of physician contracting, to ensure that as an organization, we are compliant from a Stark standpoint, from an anti-kickback standpoint, and that we have multiple checks and balances throughout the entire physician contracting process. This individual will also have a heavy emphasis on retention and not just on our current physicians, but also on our residents, and building a strategy around retaining those individuals, as well as our nurses that transition into APPs as well, because we definitely want to keep our homegrown talent as much as possible. The second position is a director of business development. And it's really someone that will help drive conversations around business planning, pro forma developments, understanding where community needs exist and what resources may need to be invested to help those community needs, and understand how to improve the cross-collaboration that exists amongst our providers. So we want to ensure that our primary care physicians, by example, know all the surgical services that we provide here, or the orthopedic services that we provide here. Inherent within that position is also a new role that we're creating called a provider liaison. It's not an MD, not a DO, not an APP, but someone that is a roving face to round on all our providers, to garner feedback, to gain opinion, which will then enable myself and the Acclaim team, as well as a number of other stakeholders, to be able to be more responsive to our providers in real time as much as possible. And so it's a two-way feedback loop there. I get their feedback, and then I'm able to give back as well deliverables and action plans. And this is not a role that is meant to be a 9-to-5 office job. It is really meant to be someone that is shaking hands and rounding consistently on our physicians and our providers. In addition, for the month of September, we have onboarded 22 providers, including an OBGYN, as well as a medical director in psychiatry. We are making a lot of efforts in a global redesign of our Acclaim website. For those that have seen our Acclaim website, it could use some improvement, no doubt about it. And so we are making an effort into that. And certainly we want it to not just be able to provide information on our providers and bios. At some point, we also want to have patients be able to use it as an access point. And whether that's linked back in through Epic and the portal there, but we certainly know as healthcare delivery changes, patients use the web and Google to find their providers and be able to book their appointments in real time through those websites at the same time. So we are making an effort. We are getting professional headshots of all our providers. We've asked them to wear beautiful white coats. And so we are excited about that, and so we're working on some of that language pertaining to the website, and hopefully be able to launch it in about 2 months, give or take. The last thing I'll mention is just a number of tasks and objectives and committees that I've asked our physician board as well as our service line leaders to begin to look at and design. One is and I had mentioned this previously, is a think tank task force, which is really built upon our frontline providers, and it allows me to have direct interaction with them to help problem solve things that they see on a frontline basis. And it's a committee and task force really designed to problem solve and not complain about things. And so that is one element. And then a big piece that we've begun to have a conversation around is around how we as providers evaluate one another. And so I've asked our service line chiefs and our leaders and our physician board to create the framework around a provider scorecard that can be delivered in real time, that providers could review on an ongoing basis, and then certainly we can use as part of an annual evaluation. And built into that is certainly an understanding around citizenship. And citizenship to me is not necessarily attending a meeting, but it's being involved, it's being engaged, it's being a problem solver. And so we want to understand how to evaluate that, how to set criteria around citizenship, and how to build that into being not just a good clinician as well. So a number of projects, a number of initiatives, but certainly I think we are continuing to move in the right direction.
Any questions, Dr. Holbert? Michael, thank you very much. Appreciate it. Look forward to next month. Takes us down to agenda item number 10, committee reports, and we'll start with finance. Steve?
Thank you, Mr. Chairman. We met on September 27th to review the August financials, and I think Sharon is here to answer any questions you might have on that. We also reviewed that was August for the 2017 budget, and then we have approved for the board's consideration about a dozen contracts that relate to the 2019 budget as well for your consent.
Sharon?
Hi, good afternoon. We are busily closing the fiscal year for September, and we'll be presenting those numbers to you in a couple of weeks at the Finance Committee. These numbers are 11 months ended August. You can see the hospital fell a little bit behind budget, loss of 712. Most of that is due to the fact that we had a year-to-date catch-up on accruing some of our quality incentive payments that we make to physicians, just because the data is not available for about the first 6 to 8 months. So we should be caught up there. Acclaim outperformed their budget. They lost $365,000 for the month. You can see our foundation activity added about $82,000 to our operating margin. So for the month, the medical center, Acclaim and foundation combined lost about $993,000. However, if you look down towards the bottom for the net income, we're about $350,000 behind our budget for the month of August. When you look at the year-to-date, and let's see, when you look over at the year-to-date numbers, we're about $1.8 million from a combined standpoint for the performance from an operating margin standpoint, and we are ever so close, about $55,000 off on our net income.
Keep in mind, everyone, this is a $1 billion budget.
So there are a lot of variances in between, and yes, that's pretty amazing. If you have any questions about August, I'll be happy to answer them. But otherwise, big presentations at Finance Committee.
Any questions for Sharon? Steve, you care to add anything else? All righty. Thank you very much.
Thank you.
Take us now to Human Resources. Dorothy?
Human Resource Committee met on September the 27th, and we had an excellent report on diversity and inclusion. And Robert, I would hope that that would be a report that the full board could see, that talks about what we're doing in the community and what a great job we're doing.
Good point.
We had, we have a couple of items on the consent agenda and maybe one closed item. Okay, that's it.
Okay. All right, Dorothy, you say you will have one for close
Yes.
discussion, okay? All right.
Mr. Chairman,
Yes.
if I could piggyback on Dorothy for a second. I didn't get a chance to attend HR because of emergency, but I got a chance to preview the diversity report. And it's my hope that it is a report that is not only just made available for us to read, but that HR and diversity office would present it to the board,
Okay.
if that's possible.
That's a good idea.
Sure.
Yeah, I think that's an excellent idea. I was at HR, and like Dorothy said, very satisfactory report, and I appreciate your comments too, Ralph, and I think we'll just so note that for the, Robert, if you maybe staff next board meeting, let's put that on there as an item to discuss. I think it's certainly, that was an excellent point. Any other discussions for HR?
No.
Then we'll discuss it in closing. Dorothy, thank you very much. Takes us to item number 11. Consider approval agreement for collection of taxes between the Tarrant County Tax Collector Assessor and Sharon. I know you were just up here, but you may just want to update us on that. I know everyone had a copy on the portal, and there's one also in the book.
So the copy of the agreement, or the executive summary, I believe is in your,
It is.
on your portal. But the cost of this agreement is about $360,000 a year. Sorry, I'm on the wrong tab. Well, I apologize, I don't have my executive summary in here. The agreement that you're being asked to approve today is the collection agreement for the county to collect on our ad valorem tax revenue based on appraised values within Tarrant County. There is not a change from the prior year, so I believe this one's a 12-month agreement.
And I think if everybody knows on the portal, this agreement's still got to be signed by the tax collector assessor, and
Yes.
Robert, I know you've still got to sign it once we approve it, and it's got to be signed by the county judge, and so it's got a lot of other signatures. It's going to be a part of this. It's very similar to what we've done in the past.
It
Yes,
is.
I mean,
There's no change.
Yes.
There are some fees that have been waived this year, again, continually, so we truly appreciate that partnership.
There's nothing, not something really new here. It's a standard thing that's got to go through everyone, be signed all the way by the county and everyone else. So if there are any discussions on that, oh, sorry, Ralph, go ahead. I have a motion for approval, Reverend Emerson. I have a second by Dr. Weber. All those in favor say aye.
Aye.
Those opposed, thank you very much. Sharon, thank you.
Thank you.
Robert, I'll turn the next one over. It's another, keep Mr. Rule busy, but it's another appointment.
Well,
to
the city of Kennedale wants to see more of Scott Rule.
Yeah.
So from a tax increment zone standpoint, Scott Rule is our representative on those cities, so we'd like to send him over to Kennedale for part of his day.
I have a motion.
Second.
I have a second by Mr. Mose. All those in favor say aye.
Aye.
Opposed, no. Scott, again, congratulations.
Obviously, you did not do your homework. It passed
Yeah.
unanimously.
You'll get the same compensation that Montgomery wanted for his service in chairing that board. Yeah, this next one's huge. It's nothing, I'll ask for, I guess it has to be technically approved, but what we did was take the calendar of this year and project that out. Obviously, it's subject to change as we go forward, but we need to have that for staff and all that. So I'd entertain a motion to approve the calendar.
Move approval of the calendar.
Thank you, Dorothy. I have a motion by Mr. Mose, second by Reverend Emerson. All those in favor say aye.
Aye.
Opposed, no. Thank you. The calendar passes. All right. Which will take us down to the consent agenda. I know, as Steve said, there's a lot of stuff. We were in finance. There are a lot of stuff's approved. If there's anything on there that anyone sees to be removed, we would consider it this time. If not, we would entertain a motion for approval of consent. Have a motion by Reverend Emerson. Have a second by Mr. Wynn. All those in favor say aye.
Aye.
Thank you very much. It'll take us down to item number 13, which is legal counsel. And I would turn to Corey and just
Yeah, I think these reports are on the portal. There were 30 contracts that were negotiated on behalf of the Tarrant County Hospital District that were under $500,000. 26 of those were under $200,000 and 4 were between $200,000 and $500,000. And again, those reports are on the portal.
All righty, we'll take that as a report. I guess at this particular point in time, I think, Dorothy, you mentioned we have an item to discuss and close, and we'll need to do privileges and close. Do y'all want to take a 5-minute break real quick before we come back? And we will take a short break and as of 1:55 and return in about 5 minutes for close. Thank y'all very much. Last year, she's a Hispanic woman, business owner. You know this one. I talked to Flo the other day. She would love to get involved with this board, the foundation board. Another Hispanic woman. Two sons are Air Force. That's why the company's named for. Anyway, I'm looking kind of for that Spanish. Super. Thank y'all very much. We will now reconvene in open session at 2:55. We have one order of business on the agenda remaining, and I'll call on Dr. Schrader for discussion regarding our privileges.
So in front, you will see a list of requests for credentials by our medical executive committee. All have been vetted by, our credentials committee and MEC, and we just entertain your consideration.
Any discussion regarding that? If not, I'd entertain a motion. I have a motion by Dr. Wepper, a second by Reverend Emerson. All those in favor say aye. Aye. Opposed, no. That passes. Is there any other business to come before the board today? There being none, we stand adjourned. Thank you.